I think we're live. Great. Good afternoon, everyone. Thank you for joining the Great 2020 Restart, How Your Dental Practice Can Prosper After COVID-19. My name is David Brooks, and I am president of SRL Group. Our company focuses on digital solutions that help improve outcomes for both patients and medical practices. And joining me today is Rosemary's Mieses-Reyes. Rosemary is president of Excellence Placement and Management. Rose, could you introduce yourself?
Thank you all for joining us today. My name is Rosemary Mieses-Reyes, President of Excellence Placement and Management. We alleviate the daily challenges of dental practice management, revenue and staffing concerns, treatment planning, billing deficiencies, and patient retention.
Great. Okay, so let's continue here. So the three things we'd like to talk to you about today are what we hope will be important and valuable tips that will help your practice thrive. The first is sharing knowledge of things we've observed from practices that are emerging bruised but not broken from this COVID-19 shutdown. We'll also give you some real-world case studies about steps that those practices took to emerge stronger. And finally, some insider advice that will help make you stronger than the competitors down the street. And if you stay with us through the webinar, we have some special offers at the very end. So let's talk about some of the things that we learned throughout this whole pandemic. COVID-19 hit everyone very quickly and very hard. And the internet was displaying a lot of wrong information, office status, hours, emergency, regular procedures, health tips, but a lot of it was conflicted. And I think there's general agreement that people neglected their online presence, and this was a perfect example of why that is just an unacceptable situation. Here's a scary fact. Half of US businesses still have not claimed their Google My Business listing. And I think in healthcare, it's probably even a little bit higher. So this whole pandemic exposed a lot of weaknesses in many medical practices. The fact that you don't have accurate online listings is meaning that patients are being very confused and misled about everything about your practice. They want to see if you're open or not. A lot of times they will check online before they'll even bother to call. What's worse is a lot of practices didn't have the tools necessary to correct those deficiencies when they discovered them. So they were literally just kind of helpless and not being able to update and correct the information and make it accurate. As practices reopen, this is going to be a real concern. And I would think that many dentists are losing business simply because patients are getting bad information and assuming that you're closed when you're actually open. So the other thing that we've learned from this whole thing is that practices are guilty of not keeping their own records up to date. So even if and when you want to communicate to patients en masse, you can't. And we found that some practices have valid emails on only about 60% of their patients. Practices realize that there's a lot of value in having mass communications tools, but either they don't know how to use them or they never purchased them to begin with. If you've got a platform like Lighthouse 360, it makes it very easy to communicate with your entire book of patients or a segment. And so if you do have them, now is the time to really get proficient at using them. If you don't have them, let us know and we'll be able to set you up very quickly and easy and even manage the entire process for you. The other lesson that we learned is patients really want you to be online in virtually everything. Communications, messaging, booking, virtual visits, payments, and of course, online feedback, and even patient-to-patient referrals. So now is the time to embrace all things digital, especially when it can be positioned as a benefit to patients. And Rosemary will discuss in greater detail practices that were techno-resistant before COVID, but are now really reaping the benefits of online dentistry. So let's talk about this a little bit. Pizza is contactless. Used cars, contactless. So patients are necessarily asking things like, why do I need to touch a dirty paper form on a dirty clipboard when I'm in your office? Why do I need to visit a crowded waiting room filled with sick people? Why do I need to come in and see the doctor in person just for a simple consult? So the real story with COVID is there's a strong desire from patients to not touch anything and to minimize interactions. And fortunately for you, there's a double benefit because most digital technologies really help reduce human interaction and human contact. And we think that's going to be the reality going forward. So now really is a great opportunity to convert your practice to having a strong digital presence and using a lot of the digital practice management tools. Your patients will thank you, your staff will thank you, and your accountant will wonder why you really didn't do this already in the first place. So this is a chart that was published by the website Dental Post. I think it's a really interesting dramatization about where we are right now, which is kind of right up here on the upswing. But after this initial surge, there's going to be some lingering COVID fears, and we suspect that there's going to be a drop-off. After people come back and have delayed and postponed the necessary treatments, we think you need to get ready and prepared to deal with the drop-off. And so this is sort of a take on that last chart, and bear with me, it will make sense. It's just a little bit crazy to look at. But the idea here is that when you're opening up right now, think in terms of expanding your capacity. And no, I'm not talking about being chained to your chair for 12 or 15 hours a day, but I'm talking about changing the office hours that you project online to let people know that you're available. So if someone will answer the phone between 8 a.m. and 7 p.m., put that up there on your Google My Business listing on your website. Provide telehealth for those early morning or late evening ones to kind of triage patients and see if they can come in or maybe they can avoid a visit. Then look at your office staffing situation. Maybe it does make sense if you can bring in those extra patients. Look at bringing in locum tenens associates, early morning, late evenings, weekends, staggered schedules, if you will. This obviously depends on your staffing and infection control policies, but I think here's the point is that you've got a lot of people who have postponed dental treatment and now they're starting to feel comfortable and they want to come back. You've also got a lot of your competitors out there who probably are having limited hours. That creates a scarcity for available dental, dental appointments are going to be hard to get. Be the practice that's open so that when other patients are searching and they can't get their regular dentist, be the one that they switch to by just being available, making yourself more available. So the other point in this, and this is sort of this drop off here, is that after the reopening stage, patients are going to be using COVID as just one more excuse to neglect their dental care. So you want to really make sure that you're emphasizing demand creation, being out there, not taking your foot off the gas on all the marketing efforts needed to grow your practice. We think, unfortunately, we think that it's going to require more marketing effort just to maintain your last year's production. And that's because of the reduced production that you might have from extra PPE, not using the waiting room as a buffer. So you want to really emphasize now the importance of ramping up marketing efforts, because if there is a slowdown, you don't want to be the practice that suffers kind of a second flattening of the curve. You also want to look at better training for your staff. And Rosemary has a really good case study about staff training and using the hygienist as the pivot point to identify new opportunities for treatment. And finally, you would want to consider things like self-hosted dental plans. This is a financial pandemic as well as a medical pandemic. So a lot of families on tight budgets want to secure predictable dental expenses. And offering a self-hosted dental plan could be the way that you can lock in those patients and get more basic patients for the future. So the other thing that's going on right now is PPE is a fact of life. Using a lot more PPE is going to be a fact of life. But it's not just about preventing the spread of the virus, which everyone agrees we want to do. It's a very important symbol that helps restore confidence in your patients and frankly in your staff. And so infection control, from our perspective, is the marketing concept for 2020. The more you emphasize safety protocols, the more patients will come back. Frankly, your employees also are going to be much more relaxed and welcoming if they feel safe and they understand that you've taken all these steps to mitigate their risk. So you want to use your COVID-19 protocols and communicate them widely across all your channels: website, social, Google My Business, emails, and even phone calls. Now's the time you should be going through all of your patient records, getting correct emails, but letting people know you're open and what your procedures are. And that in and of itself will stimulate a lot of discussion. If you've already published a pre-COVID message on your website, good for you, but consider now updating that with new information, expanded office hours, changes to the procedures. Be specific about how you're keeping patients safe. Don't just talk about random changes to your procedures, but actually get into details about what you expect from them and why you're doing it. And several clients during this whole pandemic have asked us, is now really the best time to ask for reviews? And we respond, absolutely. Reviews are essential for third-party validation. That's always been true, but it's especially true now during COVID. Now more than ever, patients need social proof that other patients are comfortable returning to your practice. So it's not enough to have a notification on the website. Patients need to repeat, like this review you see here, specifics about the things that they felt comfortable about. That will stimulate other patients to return to the practice. Okay, so now I want to turn the slide and the microphone back over to Rosemary, and she'll talk about specifically about some of her experiences pre and post COVID. Rose?
Thank you, Dave. So let's move on to generating financial acquisition with less overhead. As you're all aware of, our field is undergoing major changes, working with added pressure and fear. We have been working all along with dental treatment phobia, pressure, and fear. Now, COVID-19 concerns are added to that. But don't worry, we're here to help you. We have learned that both patients and staff are afraid. And why not admit many providers are too? But oath forces us all to move past the fear and work, and our business model and goals force us to be productive and collective, Dave. We cannot steer away from that reality. Today, we're going to share with you the strategies we have been implementing in our practices. These strategies are allowing us to rebuild our clients' practices stronger and more profitable. We are teaching our practice owners, associates, and their teams internal and external engines to move patients quicker and efficiently with safety and profit guaranteed. Dave, we have generated production and collection comparisons for pre and post COVID-19. The findings are surprising. With the four engines we have been concentrating on, we are noticing that there is a collections increase of 18.7% in a time where we were told we would be at a decline. Mind you, we are not at the surge stage yet. Keep in mind that it's with many having lack of employment, loss of income, and added fear. But even more surprising than those facts is the fact that 75% of such income is based on cash and credit card payments. So, what is this telling us, Dave? Clearly, that we're not relying on insurance reimbursement and that we're getting paid sooner for services rendered while reducing office hours and payroll overhead by 25%. That's a great discovery. This is proving us that technology speeds up office flow in online appointments, virtual triage, treatment plan presentation, online payments, and deposits collection. Likewise, it's proven to us that by retraining and reinforcing our team, especially our hygienists, to gain a clear understanding of our patients' desires and concerns to spot medical necessity, we can make life changing progress, thus warranting patient engagement, retention, and most importantly, trust. So, Dave, let's go over some rules in place for this COVID-19 dental era. Hygiene is king. Use of technology to streamline office flow. Adding treatment time does not necessarily mean adding extended hours. Add associates. Make use of your rooms. Okay, Dave, now let's get into those engines. The first engine is new patient acquisition. Start by spreading the word, docs. We need to have everyone actively participating in this challenge. Referral request. Remember always that it's in the process of saturation that you will see the best results. Review requests. We have confirmed that in the current time, everyone is driven by online presence. Requests for reviews must be made to all your patients. Remember to be careful and wise in this process, though. Remember always to wow your patient. Your request can look something like this. Miss Jones, we are so glad you continue to trust us and that you're a part of our dental family. Is there anything we could have done better for you today? Be attentive to the response. And if you have confirmed she is in fact pleased and appreciative of the level of service you have provided, then proceed. The referral request, simple. I am so glad to hear that you're happy with our service today. We would love to have more patients like you. Would you mind becoming an ambassador of our practice? Let me show you how simple it is. Do I have your permission to send you a text message? The review request. I am so glad to hear that you're happy with our service today. Can you please take the time to share your experience by completing our survey? Do I have your permission to send you a text message? Oh, and social media. If you're not participating in social media, docs, you're losing out on a ton of free marketing exposure. You need to get on it now. Don't wait. Choose a creative and reliable team member that you can trust to initiate your social media and start sharing information about your practice. Before and after photos, team photos and videos, patient testimonials, and why not oral and systemic health education? If you are already, I am proud of you and keep it up to date. Don't just open it. Let it educate your patients and the people they want to share it with. This is going to aid in generating more exposure to your practice to the public for free. Think of it as constant and free advertisement. Local community. Start creating a network around your community. Have staff members introduce themselves around the community. Let them invite people to the office. Drop off information about your office. Don't be afraid to spend a little bit on this. It's well worth it. Just remember at all times that networking will have a tremendous impact on your practice growth. Another big one, Dave, is patient engagement. Learn about your patients. Show your patient how different you are right at the initial phone call. Set them up for what they are to expect. Learn what they're expecting from you. You can achieve this before they even put a foot in your office. The new patient phone call is key. It's your triage. You can gain your patient's attention, understanding, and trust before their first visit. Dave, it's time to share the second engine. Treatment planning and recare. Doctors, you must use all the technology you're paying for to help you build up medical necessity. Use your intra and extraoral cameras. Show them what they are truly working with. Patients can understand your x-rays and they can't understand your x-rays and beautiful dentograms. Use the dentistry for dummies philosophy. Start taking blood pressure and discussing systemic health. Teach them the true links between oral and systemic health. Discuss nutrition. Make them understand how serious you are about keeping them healthy and beautiful. Use the patient's medical history and triage to your advantage. Stop skimming through it. If you train your staff, you will be able to have adequate patient retention right from the clinic floor and obtain the yes in the chair. Rather than praying for your financial coordinators to sell the case, make sure your clinic floor is your showroom. Let financial be financial. You will see a huge difference. Then you will hear patients asking, what do I need to do to have my treatment done? What options are available for me to cover my investment? Stop watching treatment. Call it what it is. Diagnose it, collect it, and treat it. Bring your team to a level of excellence that ends the phone calls and converts it into pre appointing and reminders. Use the patient communication vendors you pay. You pay these vendors, so let them keep your schedule up to speed. This will allow you to keep your recare system and treatment plan reports clean, up to date, and profitable. Dave, I think they're ready for the third engine. Dental membership plans. We have learned that during the COVID-19 pandemic, many have grown a concern about not having dental coverage or disposable income to cover the cost of treatment or routine care. Don't worry. We're not going to ask you to join every insurance carrier in the world or to run a nonprofit dental business. On the contrary, I'm asking you to market your very own dental membership plan. This will result in being attractive to existing and new patients. It will open the door for them to look into your practice and prepay to see you. It will aid in search engine optimization and treatment acceptance. See, it's simple. They join the membership plan right online, receive recare and diagnostic services within their paid term, and current treatment plans will be discounted for the agreed membership plan allowance. Most of my practices are promoting a 25% and a few are at 20. Docs, you know your demographics. Be creative, honest, and wise. It's a win. Okay, Dave. Now moving on to the fourth engine, collections. Stop running your practice or allowing others to treat your practice as a nonprofit organization. Yes, you can help the community, but you must keep your business model in mind. You have to put a set collection and billing system in place. Run your reports, know your numbers, share them, and hold team members accountable. I have met with so many doctors that have never heard or been informed about the different reports available in their software to ensure your production and collections are near equal to. Stop working with a closed eye. Expose your insurance acquisition. Be informed of your age claims and unsubmitted claims. Be informed of patients with balances or credits. Turn your practice around. Let your website and vendors help you. After all, you're paying them whether you use them or not. Don't forget to use your website to the maximum. Add your online payment portal, collect payments on balances, membership plans, collect deposits for your appointments right through the website. Use your technology to send billing statements and reminders on pending treatment plans. Don't hesitate to collect. Be fair to yourself and to your business. This is the moment. Now, let me put the excitement and coaching to the side. Let's talk about the elephant in the room right now, Dave. Employee fear, patient fear, COVID 19. What a burden. You guys are working under serious pressure and fear right now. Talk about tension. But guess what? There is a way out. Start by mandating testing of your employees. Not only does it cover your liabilities, it also shows concerns for patients and employee safety. Train your team on safety, and they will learn how much you care about them, how much you do have available to protect them, the patients, and in essence, yourself. Maximize your electronic patient record management capabilities. Do online form completions, parking lot virtual check ins. Implement hand wash and hand sanitation for patients and employees in your office. Do temperature checks. Activate your air purifiers and let your team and patients know what they are doing to keep them healthy and safe. Go over all the benefits of each PPE item available, your gowns, shields, masks, hairnets, shoe covers. They will gain ease. in coming into the office. On the clinic floor, remember about the aerosol collectors. Dry Shear and Relief are some HVE devices available to you at an affordable price that will result in less fear and confidence, enabling systems and engine requirements to be exercised at 100% by your employees, associates, and patients. This is the moment to start fresh. Don't miss the golden opportunity. Totally reset and retrain your staff now. Thank you for making the time to register for our webinar and participating. I look forward to answering your questions.
Thanks, Rose. So before we
Thank
get
you, Dave.
before we get to questions, let's just kind of recap what we've shared, and to just give you, I guess, a summary about what we'd like you to take away from this. The first thing, now more than ever, take the time to claim all of your business listings. Make sure that everything online is accurate, up to date. Have all the passwords ready. Make sure that everything is picture perfect, and that you are using that as a way to communicate to patients. Now's the time also to really invest in online booking, online patient messaging, online payments. Your patients want it. Your accountant wants it. Everyone is going to benefit from this one. So really take that plunge now, and then look at rethinking all the interactions in your practice to expand capacity, but to reduce the potential for infection. In the process, you'll be surprised that, plus the combination of a lot of the online tools, you'll actually, as Rose had demonstrated with one of her clients, you can demonstrate greater production, greater cash collections using less staff. And I think we're now hunkering down for the reality that a V-shaped recovery is probably not in the cards. So don't flatten your own curve. Focus on emphasizing safety and infection control in your marketing messages, and take patient recall seriously. Use your tools to activate existing patients to refer new patients to the practice. And as Rose was suggesting, consider a prepaid dental discount plan to respond to, or to offer a solution for those patients that maybe have lost their dental coverage. Okay, so I promised you a couple of free resources for staying with us. The first is in the PDF that I'll email to everyone that participated. There's some links here that will take you to what we thought was some range of helpful resources. If you're doing telehealth, there's kind of a code cheat key, so you can see there. To my knowledge, there are a few dental-related telehealth billing codes that could work. There's also a Google AdWords credit, so you can start advertising on Google, and then a Google My Business free marketing kit, especially around COVID-19 reopening. And finally, there's a new capability that you can actually text with your clients on your Google My Business account. And in our experience, about half of your traffic is coming from your Google Business listing. So being able to text and live chat is a really important feature. And finally, as a special incentive, if anyone watching today subscribes to either one of our services from either Excellence Placement and Management or from SRL Group, we'll give you an Apple Watch. That's our gift to you. You have to subscribe to services no later than 9 p.m. on July 31st. And then if you'd like to book an appointment with one of our practice growth coordinators, either visit our website at srlgroup.co, not .com, .co, or call us. And you can either call myself at the number listed here, or Rosemary at that number listed there. And so without further ado, I'm going to open up the floor to questions. If anyone has any questions, I believe you can enter them in the chat window below. We have a question here from Sophia. How can patients learn about practices COVID safety measures? So a couple of different things that we recommend. Obviously the CDC is a first start. A lot of the ADA has published a lot of very good a lot of good guidelines for dental practices. Surprisingly, a lot of the state dental associations are really on top of this. So I would check probably your state and local one. The other thing I didn't mention before, but I really think it gets into this hard about, teal being the new black. Embrace the fact that your patients are looking for you as a doctor to be the primary source of medical information in their lives. So that's where you should take your social media. That's where you should take, your blogging if you do that. Use the content that you're reading about and then put your own spin on that. And your patients will really respect the fact that you're stepping up, you're talking about that. It's not just about getting them to come into the chair, but it's about making them feel that they're loyal to you and that you're a source of truth for that information. Rose,
Um,
yeah,
Dave, sorry.
go
I
ahead.
was also I was going to type it, but in addition to that, Sophia, if you are specifically referring to your practice safety measures and your patients being made aware of that, I will invite you to inform them again by using your technology. You can make a general email blast to your patient population of active patients and send them information, letting them know these are the new norms of our office upon your entry at check-in, what they are looking at upon hand washing and sanitizing, what they are looking at as far as forms, what they are looking at in the operatories, how they're expecting masks, how they can't have guests. You can inform them.
Okay. We have a question here from, I'm sorry, I'm going to mispronounce your name, Ekbal El Kadri. Do you suggest any particular methods to improve billing efficiency and collection efficiency? Rose, I'll turn that over to you.
Adequate treatment planning, consistency, and informing your patient of what your financial policies are prior to completing treatment.
Do you have any, either case studies or anecdotes about the success of using online bill pay versus traditional collections?
We do have a comparison that we did from pre and post COVID, Dave, and surprisingly, patients are content with receiving their information over the phone via email with your staff and securing their appointments by making their deposits and making their payments towards treatment for services to be rendered. They
So,
are making their payments in advance.
so you're saying that accepting or creating a payment requirement for appointments, are you getting?
Yes.
Yeah.
Yes. We are getting yes. We are getting okay, so we're relating it to the fact that because patients are paying at the time of acceptance, Dave, they're not breaking their appointments.
Mm-hmm.
They're coming in. They know already. They know your appointment policy. If you cancel the appointment, we're going to take from that money that you paid. If you don't show up, I'm holding your money and you're not getting any worth for it in the meantime.
Yep.
So it gives them that added push to be respectful to the
Yep.
doctor's schedule
Yep.
and to their needs.
I think there's a lot of other industries where it's very common practice to create a credit card and charge in advance, and so like you said, it keeps them respectful of the doctor's time, and it also
Dave,
gives you a means
yes,
of payment for
Dave.
collection for
And
services
you know
rendered.
what? Uh, In some of my practices, I had to help the doctors get over the fear of presenting it because they felt it was too pushy. But if you make a nail appointment or a hair appointment or a vet appointment, you have to make a deposit and they don't question it.
Yeah.
They
No,
make it.
exactly.
So again, respect your payment policies, respect your time docs, and allow the fairness.
Yeah. No, exactly. And arguably, it's a lot more important. This is one of those vital professions. So yeah, you should feel no hesitation. Someone had emailed me a question before I want to get to that because I think it might be relevant to a lot of people. What about Facebook? Do you recommend Facebook? And I can tell
I
you, so yeah,
yes.
Rose, do your clients find
Yes.
that? Yeah,
Yes, and it's great because it has such a great effect, especially if you're posting before and after photos or
yeah,
video testimonials of patients when they receive their new smiles. This is good with doctors that are doing oral rehabilitation, um, or Invisalign, full mouth rehab. Sorry, Dave. And it's amazing because now everyone is liking or sharing the video, and it creates mass marketing.
yep. I and
Plain and simple. It's
yep.
like a chain reaction. Just like they do it about bad news, they're doing it with the dentistry. And this is how you start generating more people, more people, more people on your Facebook page for the business.
There's two things that I've often seen. Not all of our clients have the resources or the comfort level with that, but the ones that do are doing really well. And it comes down to there's a certain amount of credibility that comes with a third party endorsement with Facebook. It's a very human kind of touchy uh, channel. And so that someone kind of proudly posts their before and after pictures or makes an endorsement to their friends and family, that really carries a lot of weight. It's also something that if you have to approach it not with the attitude of like a drudgery, like, okay, happy 4th of July, everyone, and something like that. I think that quickly turns off a lot of people. So if you can find someone on staff that really embraces that challenge and really think about set yourself up on maybe a once every week kind of regular schedule and really think about sharing something that's personal and meaningful to people. That authenticity carries forward, and that's what makes it really successful. People recommend you, and they deal with that. And Facebook also has a paid channel. We've had some success with that, but it's still kind of in its early infancy. It's the good thing about it is it's really inexpensive, and you can micro target people based on geographic location, but also demographics. So if you have a certain patient population you want to go to, such as people of a certain age that maybe are candidates for dental implants, you can actually target just those people, and the cost for those leads are relatively inexpensive, and they could be very productive. So Facebook has some pretty good options for you that way.
Absolutely. We have two more open questions
I
coming
see that.
from
Stephanie.
Stephanie.
Yep.
Says, Rosemary, how can we have employees more motivated to participate in patient engagement? Well, the first step is going to be training. If you train your staff to understand how the treatment that you are presenting to your patients makes a difference in your patient's life and health, they will see the value. If they don't believe in the dentistry, if they don't believe in what the patient is receiving, they, as employees and clinicians, don't have added motivation.
Yeah. That's
So when they learn, now they're worried about giving the patient the right information, being conversational, having the proper questions to properly analyze your patient. Because let's be real, patient engagement is all about you being able to analyze the patient for their motivators, their needs, their wants, what drives them. Okay, so that you can use all these little aspects of information that they're open enough to share with you to bring them to what they really need. Remember, sometimes anatomically speaking, what they want is not what they need, but you can use what they want to bring them to what is needed. One huge example that I use, very common, patients call in, I want to have whitening, but their periodontal disease is ramping beyond any acceptable mean. So we have to bring them back. Yes, you want to have the whitening done, but we want you to understand that for your health and for the condition of your gums, what's best is that we treat the infection. And if they don't get it, then bring them back to the understanding that if I do this whitening on you and you have periodontal disease and you have severe bleeding, I can't warrant that you're going to have white teeth because the blood can stain them.
So one other point that it's sort of implied in Stephanie's question, I just want to emphasize this one. How do you motivate employees to participate in patient engagement? So there's the in the chair, but there's
Right.
also the at the front desk and outside in the public. And
Yes.
frankly, so that's where paid incentives can be a very important thing. And it doesn't have to be cash. It could be psychic wealth. It could be stars on a board.
Yep.
But
Yep.
you want to put
Employee of
in
the month.
exactly, exactly.
Yes.
And so like using like we have a patient-to-patient referral program, Referral Voodoo, and that is very successful at recruiting your employees to compete to bring in other
Yes.
friends and family to the practice. Of
Yes.
course, you expect them to do that as a condition of their job, but sometimes people forget and they need a boost and a reminder, and incentives can provide
Yes.
that incentive, and they can be meaningful. And if they're very good at it, it can be a substantial part of their compensation.
And
You know,
also, Dave, let me remind everyone that's on with us and that can see this in the future. Remember, it's not only limited to in the chair. When we're explaining it right now, it sounds as if I'm driving it towards clinical, but absolutely not. I want everyone in the office. I'm expecting everyone in the office to be an active participant in patient engagement, whether it be on the phone, outside in the community, if you saw the patient on the block, or on the way to the parking lot. If you saw the patient at the supermarket, you have to engage and learn about your patient.
yeah,
If you are in the office with the patient and you cross by the hallway, engage with the patient. No staff member, no provider, no associate should make any encounter with any of your patients and not acknowledge them and engage in conversation.
exactly.
A simple hello goes a long way, and that's how they're going to remember that you are different than any other practice out there. And that's what's going to make you stand out and be above the mediocre dentistry that they are comparing us to.
Yeah, exactly, exactly. So Mr. El Kadri had one additional question. When you suggest to mandate COVID tests for employees, that's assuming the practice will cover all expenses, correct?
Not necessarily. In many states and communities, the tests are being provided in the local testing sites. In areas where that is not being provided, then the office should cover the expense if you don't offer medical benefits. If you offer medical benefits, in my practices, I have geared them towards having it done and the employee covers their copay. Remember, it's not only a benefit to your office that they have this done, it's a benefit to them too. It's for their own protection and for the protection of those around them. You want to always bring it back to this is for your best and for the rest of us that surround you.
Okay. Hope that answers your question. We have one more, I think time for one more question here from Stephanie. Can you read that, Rose? Do you see that?
Sure. You mentioned learning what the patient is expecting from us starting from the first phone call. How would you recommend we do that? Well, in our practices, we have certain forms and scripts that we have our teams using at the front desk, which you engage in a conversation with the patient and you get discovery as far as what their interests and concerns are, how we could better their smile, what concerns they have health wise. We get into allergies, medications. We're pretty elaborate in a very short phone call. We also have engines shared also with you, Dave, where we can monitor that and use it to train the staff.
Great. Okay, we're coming up. It's exactly 2:45. I think we had scheduled this for 45 minutes. So I want to thank everyone for participating and for your questions. Again, if you would like to get a free Apple Watch, just give us a call at these numbers and subscribe to either one of our services for before 9 p.m. on July 31st. with that, I will thank you. If you would like
Yes,
more
thank you.
information, please visit our website or excellencepm.co. Thanks again.
Thank you.